I don't see a way that we don't end the pandemic or make it at least endemic without a really strong ability for at-home testing.
Virginia Garcia Memorial Health Center will soon get its first shipment of at-home COVID tests to be given out to patients at its 5 clinical pharmacy sites in McMinnville, Newburgh, Cornelius, Hillsborough, and Beaverton. Hazel Wheeler, the Health and Safety Programs Manager, explains.
We should be getting a pallet of testing kits anytime now. When exactly that is, we're not sure. We know that the order is completed and it's set. It's just a matter of when it actually shows up. And what that really does is remove a lot of the strain that's been at the clinical sites to administer the test. That can now be handled at home. And then when there is an issue with reporting or there's an issue with a positive, then we can have the patient reach out to the providers and if needed, bring them in. That then allows for other care to be provided for other reasons.
Over the last 2 years, Wheeler says Virginia Garcia administered 19,000 PCR tests. The upcoming initial allocation of 13,000 at-home tests will greatly increase testing capacity for a community hit disproportionately hard throughout the pandemic.
Latino and Hispanic population having a significantly higher positivity rate. So in general, for our patients, they're seeing about a 22% positivity rate within the Hispanic population. By comparison, our other patients are only screening at about an 8% rate. And that's, again, over the course of that almost 2-year period.
He said that's reflected in current numbers, showing a positivity rate of up to 45% for the last week.
What that tells you is, as you do more testing and you get more positives, it just means there is truly more disease out there and it's just not being identified yet.
The Oregon Health Authority has also ordered 6 million self-test kits. So far, it's received 1.9 million. More than 500,000 went to hospitals, more than 100,000 to schools. And another 500,000 we're told they're holding back to be able to continue to fill hospital and K-12 orders on demand. Just this week, OHA opened up the order process to local public health authorities and tribes. Multnomah, Washington, and Clackamas County Health Departments all submitted orders within the last 48 hours.
All right, just because these local health departments will soon get a shipment, that doesn't mean you'll be able to go through them to get an at-home test. Once they receive them, they're distributing these tests through community-based organizations to people who live or work in settings that put them at higher risk and those who historically have had a tough time accessing testing.